Good evening, everyone. From the look of things, today is going to be a very interesting outing. Our people say that you know a good weekend from Friday. So we are just 3 minutes and the numbers are already 2 minutes and the numbers are already trickling up. However, for the need of those that are yet to join us due to one reason or the other, I plead with us that we start at exactly 5 minutes after 9. So please use this time to call your friends, to call others who should be here. Once more, we welcome you to tonight's meeting. Thank you.
Disturb. I just try it. Ọlọ́run jù wá. Ẹ kú bájì.
What is 1,500 pounds in naira?
All right, thank you so much. We are most welcome once more to another interesting moment. So we would be starting this meeting immediately. I want to welcome every one of us. So we'll be starting with an opening prayer. I've cited one of our very senior friends and my very senior friend, Dr. Modupe Oyawole. I would like to plead with her to please grant us the privilege of beginning this, having her say the opening prayers for us. Mommy, ma, can you please say the opening prayer for us? It's been a while I heard your voice. Thank you, ma. Hello, can you hear me?
Hello, can you hear me?
Hello, can you hear me? Oh, ma, you're muted. Dr. Yawole, you're muted, ma.
Hello, can you hear me now?
Yes, we can, ma.
Okay. Good evening, everyone. You're all welcome to the call. Okay, so let's pray in Jesus' name. In the mighty name of Jesus, our Father and our God, we thank you, we bless you. We thank you for this meeting that we're about to have, which is targeted at improving our knowledge, and so that we'll be able to increase this knowledge and use it for humanity. As we start this meeting, we ask that you start with us, that every utterances that we make will be the right thing, and we will all gain knowledge that will help us. We ask that you make our profession to continue to have its rightful place. And in all things, Father, you always take control with everything we do. Thank you for we have prayed in the precious name of your Son, Jesus Christ. Amen.
Amen. Thank you so much, Dr. Modupe Oyawole, FPSN, FNA Farm. Thank you so much, ma. We really appreciate. So, we'd like to welcome every one of us to this clinical meeting. Today's own is more for the Gen Z pharmacists. We'll be discussing something very important that cuts across every branch of clinical pharmacy. And so I'd like to welcome us specially, even before welcoming any other guest in our midst. I'd like to tell you that we are excited that you are here. It means that you are committed to knowledge and learning. I'd want to recognize the SIPA National ESCOs here. I have cited the National Chairman, Dr. Maureen Wanfo. I have also cited the National Secretary, Dr. Issa Abdul Momin. Please, I'd like to plead with us to mute our mics so that you don't distract the class. Thank you so much. And I know there are other SIPAN ESCOs here. I'd also I think I've cited Dr. Motihat Olulawal. I've cited one-time Dean and current Dean, College of Pharmacy, Dave Umahi University, Professor Brian Ogbonna, and I've cited Group Captain K Folami, and I know I may not know everyone. I'm seeing a Kingsley. I presume it is Dr. Kingsley Chinedu Amibo. Happy birthday once more, sir. Thank you for celebrating your birthday with us. So I want to appreciate every one of us and welcome us. As we progress, we are going to learn. Our numbers are increasing. And at this point, I'd like to welcome to the podium our speaker. He is one that is well known to us, and he has carved a niche in the world of digital health and clinical pharmacy. He was the director of pharmacy at the University of Ilorin Teaching Hospital. He has also served CPAN as an unofficial member, and he is currently the Publicity Secretary, West African Postgraduate College of Pharmacists, Nigeria chapter, and he's a drug information pharmacist and a clinical pharmacist with expertise in drug information and information technology. At this point, I'd plead with us to welcome to the podium Farm Dr. Ibrahim Kolawole Bello, a special ambassador of the Clinical Pharmacists Association of Nigeria. You're most welcome, sir. You have the floor now. Dr. Bello, please go ahead. Okay, I think you are muted, Dr. Bello. You are talking, we can see your screen, but I guess you are muted. Kindly unmute your mic, sir. Okay, I think Dr. Bello is having network glitches. Please kindly mute your mic. So while we are waiting for him, from diaspora rather, I cited Dr. Ademola Suleiman. You are welcome. I've also cited Pharmacist Nuruddin Usman, who is our project coordinator in CPAN. You are welcome, sir. And from Dr. Fumilayo. You are so much welcome. I've also cited one or two. Okay, Dr. Bello, are you here?
I'm back now.
Oh, that's good. Beautiful, sir. Please, you have the floor.
Let me share my screen. Sorry about that. Can you see my screen now? Hello? Hello?
Yes, we can.
Okay, let me start now. Okay. Okay, good evening, dear all. I'm so glad to be with us tonight to discuss a very important topic titled Application of a Digital Health in Clinical Pharmacy. As introduced, Dr. Ibrahim Kolawole Bello, a clinical pharmacist and a drug information specialist. So in the outline of our presentation, we'll be looking at the following: introduction, key digital technologies, relevance to clinical pharmacy practice, pharmacy databases, AI tools in clinical pharmacy practice, other useful tools, then challenges, takeaways, and conclusion. And what are the learning objectives? At the end of this presentation, we are expected to and explain its significance in modern pharmacy practice, identify key digital health technologies relevant to pharmacy practice, be able to discuss how digital health tools enhance clinical decision-making and patient care, explore major pharmacy databases used for evidence-based practice, then examine the roles of AI tools in clinical pharmacy practice. Also evaluate other useful digital tools that support pharmacy in daily workflow. Introduction. As pharmacists, we stand at the defining moment in healthcare, where digital health is no longer a vision of the future, but a reality in pharmacy practice today. Our role is evolving from dispenser of medicine to digital health. Hello, can you hear me? Okay. Our role is evolving from dispenser of. Okay, good. So our role, like I said, is evolving from dispenser of medicine to digital health enable clinicians who use technology to optimize therapy, empower patients, and improve outcome. Digital health is not going to replace us as we feared, but it's going to enhance our expertise with tools that will make us, that will give us, that will make frontal care more precise, accessible, and patient-centered. So, what is digital health? Digital health refers to the use of information communication technologies to improve health and healthcare delivery wide range of tools and systems that support prevention, diagnosis, treatment, monitoring, and patient engagement. Now, let us have a look at the key digital health technologies. On this list, we have telehealth and telepharmacy, electronic health records, mobile health, wearables and remote monitoring, artificial intelligence and big data, automated dispensing, drone technology, clinical decision support system, digital therapeutics, point of care manufacturing, personalized medicine and pharmacogenomics, then 3D printing. Then let us look at them one after the other. Number one, telehealth and telepharmacy. Telehealth is digital technologies like video calls, mobile apps, and remote monitoring to deliver healthcare services at a distance. This is coming to play during the COVID-19 pandemic and has come to stay with us. So also telepharmacy, that is a specialized branch of telehealth focused on providing pharmaceutical care remotely. Electronic health records. Electronic health records are a comprehensive digital version of a patient health history. It includes medication diagnosis, allergies, lab results. It shares across various care settings to improve patient care. Nowadays in Nigeria, this is taking ground. All the hospitals, both private and government-owned, are key into this technology. Next is mobile aids. Mobile aids is the use of mobile devices like smartphone to deliver and support healthcare services, collect data, and promote public health. We have wearables and remote monitoring. Wearables and remote monitoring uses devices worn on the body or at home to collect and transmit patient health data to healthcare providers, enabling continuous health tracking, early detection of problems, and management of chronic conditions. Then artificial intelligence and big data. Artificial intelligence and big data are two distinct technologies to extract actionable insights from large data sets. Big data provides the massive amount of information that AI systems need to learn, while AI provides a tool like machine learning algorithm to
Sorry, sir, if you are speaking, we can't hear you.
Dr. Bello, we can't hear you, please, sir.
He's not online.
Your screen.
He's not online.
Gone off.
Yes, I'm back with my phone. I'm back with my phone by my
So can you share your slide? That will help you to share.
I think he's having network glitches. Let's hold on a bit, please, so you can sort.
I've sent the slide to you, but let me continue. So in case I've already let me continue from where I stopped. So we have discussed AI intelligence and big data. Moving on to Moving on to digital therapeutics. Digital therapeutics are evidence-based clinical grade software that delivers therapeutic intervention to prevent, manage, or treat a medical disorder or disease. They can be prescribed by a physician to be used alone or alongside other treatment like medication. Then personalized medicine and pharmacogenomics. Personalized medicine uses individual genetic makeup and lifestyle to tailor treatments from one size fit all approach. Pharmacogenomics is a key part of this as it studies how a person's genes influence their response to drugs. Automated dispensing. Automated dispensing refers to a computer control system that store, dispense, and track medication, primarily in healthcare settings like hospitals and pharmacy. This is often called automated dispensing cabinets or automated medication dispensing machine. In developed countries, you need to go to the hospital for your follow-up for your fill-up. All you need to do is to go to a nearby dispensing unit, then collect your medication, your refill via automatic dispensing cabinets. Next is a drone technology. Drone technology are used for medicine delivery to transport urgent medical supplies like blood, vaccine, medication, especially to remote or hard to reach areas, improving speed and efficiency. They can bypass traffic and poor road, emergency supply, organ transport, and sample delivery. So what are the relevance of all this to pharmacy practice? Number one, it enhances medication safety, it improves access to pharmaceutical care, and it supports personalized and preventive medicine. It strengthens interprofessional collaboration and driven evidence-based practice. So having looked at digital technologies and their impact on clinical pharmacy practice, now let's have a look at the pharmacy databases. Pharmacy databases are a collection of information about drugs and medications, ranging from clinical data to researches. They remain the backbone of evidence-based pharmacy. Examples include UpToDate, Let's See Drug, Drugs.com, Access Pharmacy, Pharmacist Letter, Pharmacy Library, HEMDES, and TRIP databases. Number one on this list is UpToDate Let's See Drugs. As pharmacists or community practice, we need to be familiar with this. And what it does is it's a drug reference system. It functions as a point of care drug information tool intended for clinicians to make safer and evidence-based medical decision. Number two is Access Pharmacy. Access Pharmacy is an online subscription-based education and educational materials. It is designed especially to support pharmacy students, faculty, and practice pharmacists with curated tests, multimedia, and clinical tools. We have a Pharmacist Letter. Pharmacist Letter is a subscription-based resources for pharmacists, summaries, and doctor therapy recommendation. It is designed to help pharmacists stay current in medication therapy, regulatory changes, drug safety, and practice trends. Next, we have a Drugs.com. Drugs.com is an online drug information portal targeting both patients and health professionals. Provide free access to a large collection of drug monograph, tools, and clinical features. It is free and is so huge when it comes to clinical content and features. Next is MDES. MDES is Nigerian leading reference for drug is a Nigerian leading reference for drug and therapeutic information targeted at healthcare professionals. It comprises
Hello, Dr. Bello. Are you still there?
It seems he is having network issues.
Yes.
Back, sorry. Yeah. Okay. I think I'm on MDES now. When I was saying that MDES is Nigerian leading reference for drug and therapeutic information targeted at healthcare professionals. It compiles details on NAFDAC approved drug product, including generics, brand, strength, dosage form, and more. Then we have a TRIPS database. TRIPS stands for Turning Research into Practice. It is a clinical research engine, evidence-based medicine resource intended to help clinicians find high-quality evidence quickly. TRIPS aggregates content from many sources like systematic review, clinical guidelines, primary research, ebooks, patient information, and more. Now that I've done with databases, we're now moving on to AI. AI tools in clinical pharmacy practice. What are their roles? AI tools in clinical pharmacy practice enhance accuracy, efficiency, and patient-centered care by supporting pharmacists in data analysis, decision-making, and communication. AI is expected to play an even greater role in precision pharmacotherapy and healthcare optimization. On this list, we have ChatGPT by OpenAI. ChatGPT can assist pharmacists with drafting clinical notes, summarizing patient care, and generating patient education materials. Used in practice, it summarizes drug monograph or clinical trial data, generate medication consent script. It could draft SOAP note or pharmaceutical pharmacotherapy plan quickly. It assists with kinetic calculations and dose adjustments. The developer of these tools said that they are trained to the level of a PhD holder. So if you want to use it in clinical pharmacy practice, it assumes you are using somebody that has a PhD degree in that field. Just take note. Then Gemini by Google DeepMind. Gemini integrates multimedia. It can be used for text, image generation, and video generation. And used in practice, it can be used to interpret live trends or visual data. We use to extract key points for medical imaging or reports linked to pharmacotherapy. Provide evidence-based treatments suggested from via Google Scholar or medical.
Dr. Bello, I think your screen is your network.
Yes, I'm back now. Sorry, I didn't miss. I have serious issue with network here. I'm back now. So sorry for that. So let's continue. So we are talking now on Gemini Google by DeepMind, and we've discussed their applications. That is, it can be used to interpret trends in lab data, then extract key points for medical images or reports linked to pharmacotherapy, provide evidence-based treatment suggestion via Google Scholar or medical guidelines integration. Then we have a Claude. A Claude,
Sorry, sir, your screen is not visible yet.
Hello, Dr. Bello. Are you still with us? His network is really disturbing this night.
Moderator, you can summarize what we have said so far and we wait for it.
Okay, so from the foregoing discussion, we've been trying to look at digital health and its use, especially to those of us as clinical pharmacists, the ability to use digital health and improve our practice in whichever facet we find ourselves, whether community, whether industrial, whether academia, whether hospital, and all of that. So we have looked at various, this thing, we looked at mHealth as a digital health tool. We looked at telehealth. We've also looked at MDEX, and we've looked at Gemini and AI. So these are tools that, as a pharmacist, much more a clinical pharmacist, you can use in your practice. They are handy to help in disease information about diseases, about drugs, and every other sort of assistance we can get rather, to make our practice better. I think Dr. Bello is back. Dr. Bello, are you back?
David, are you with his slide so you can share while he can talk with his phone?
No, I think Dr. Issa is with his slide. Dr. Issa, I guess he shared
I
it.
can share it now.
Okay. Let me put a call across to him to join with his phone whilst we help him share his slide. So while we wait for him, I think we can have a brief interaction in 2 to 3 minutes. And in fact, the point in the interaction, some of the points are already popping up. So digital health technology is where the world is gearing towards now. However, it does appear that low and middle income countries, which Nigeria is part of, they've not fully embraced this issue of digital health. So I'd like to receive reactions. Can we hear 1, 2, 3 challenges to the full embrace of digital health in our country? And then can we also have 1 or 2 or 3 responses on the prospects? Do we think is something that can take full charge in Nigeria? More still, seeing that there are places where there is inequitable access to healthcare. So within the next 3 minutes, the floor will be open. You can either raise your hand and speak, or so that we can just hear you. 1 minute each. We'll take 3 impulse fills and we'll continue. So anybody can speak, please. King Charles, you have the floor. Kindly speak, please. King Charles, unmute your mic and speak, please.
Okay, thank you so much, the moderator. All right, the side I'll be commenting is on the challenges, the supposedly challenges that we might that might have actually hindered the optimal use of digital health. Hello.
Please go on. I've muted her.
Okay, so the one of I think one of the core thing is borders on the awareness of the valuable tools that are useful, and that is where the importance of tonight's discussion comes in. I think if there will be adequate awareness, making professional like the pharmacist, despite the area of practice, to be well abreast with the valuable tools and how to use them, it will really go a long way. So, in summary, it's just more of creation of awareness is needed. Thank you.
All right, thank you so much. I don't know if our speaker is back. If he's back, just give me a signal. Now, I want to drive this home more. Can we look at the ethical acceptance of this digital health? For instance, a student writes assignments with AI, and that student writes a clinical pharmacy assignment with AI, and that student is rigged, and the person fails. Or a patient walks into the pharmacy and tells you that, please, he or she is sick, and that he has used AI to Google his or her symptoms, and you are a community clinical pharmacist. Or you give a drug to a patient in the hospital, and the patient uses AI in your front, and says, that he or she found out that he or she cannot take this drug using Gemini and also. Can we draw a line between ethical acceptance of this AI and practice? Somebody is clapping for me. So I would like to hear our reactions on ethical acceptance of AI. Is there a limit we can accept this or not, or otherwise? Yes, one response. I think our speaker is back. One or two responses, and we'll get back to the class. Okay, Valodele, pharmacist Valodele, can you please unmute your mic? You have the floor now.
Yeah, thank you. Good evening, everybody. Just want to weigh in on this. First and foremost, I need to say this, that we need to begin to think about adopting new technologies. It's very important. We're already way behind. I'll give you an example. I heard that when the calculator was to be introduced into schools, the teachers in Norway went on strike. The math teachers in Norway went on strike, and they said, I know calculators will make the students lazy and stuff like that. But today, nobody thinks twice about using a calculator, right? Then also, computers came in, and people were saying, computers can't do much. I mean, you can't take the place of people. Computers now have rendered some persons jobless, right? Abroad, before now, people had what they call PDAs, personal digital assistants, so that when you're with a patient and, you need to get information, you check your PDA and everything, and you're looking at the patients, all the patients that are imputed, and it gives you on-time, real-time information to help you make these clinical decisions that will help the patient. So it doesn't take anything from you, but you need to be clinically savvy as well as understanding how to use those tools. They are just tools. It just means for us to raise our game to see how we can catch people who are cheating. For instance, for those of us in academia, for instance, the AI tools can help the students, do better. But there's some aspects, interpretation and stuff like that the student has to be able to learn and apply himself. So to gather data, to draw questionnaires and things like that, the AI can help you do that and do it better. But making decisions, that is what you need to do. So he provides the tools for you. All right. And then the ethical part is this. If you're going to use AI, you must acknowledge that you use AI and tell us where you use the AI and everything. And then what is your own input? That is how it works. So let's not be scared. Yes, people might want to misuse it, but it will come in very handy. Things that you probably would have done in 3 months, you can do it in 2 minutes. It saves a lot of time. And then you can now focus on other things, what the human eye can do better than the AI. These are the things that we can do even as pharmacists too. And there's no harm in a patient coming and say, I've used AI and I think this is what is wrong with me. Then you two can also check, okay, fine, this is what's wrong with you, and these are the drugs. Okay, fine, let's look at the drugs that AI has given you. Then you double check and cross check. If it's okay, then it's okay. Then you use your own AI as well too, and then use your clinical know-how, and then the patient's symptoms that is presenting and other things. So these are the things that we must begin to try to learn now. And that's why I'm happy that we're having this particular lecture today, so that it will broaden our horizon, help us to have grasp of all these things and know the tools and how to use the tools. Let us not be scared and think that this has come to spoil things and make people lazy. No, we must up our game to understand how to use AI ourselves and also improve even on these AIs as well. Thank you.
Wow, that was a nice one. Thank you so much, Pharmacist Val Odili. That was a nice one. I don't know if our speaker is back.
Our dear moderator, the last speaker is Professor Valentine Odili.
Oh.
He's the chairman of the Faculty of Clinical Pharmacy. Now, WFPC.
Oh. Please forgive me, Prof. Thank you so much, Professor Val Odili. Thank you so much. That was really nice. Thank you so much. We are.
I'm a pharmacist. Thank you.
Yes, I didn't know the appropriate title, so I just used pharmacist. That is a common denominator.
And you're correct.
Thank you. My national chairman.
Thank you, Dr. Morin, too.
has helped me. She didn't use AI to know this one.
Exactly. Thank you.
Thank you so much, Prof. Man. We are most grateful. So I don't know, Dr. Issa, have you gotten across to him? Or do we take one more comment?
Not be able to join, so that we can share the slide, because he has been trying to join and it's not working for him.
All right. So would you help us?
I've dropped it on the education committee group. The chairman can share it from there.
Okay. All right. Okay. So there's no problem. Our slides will be shared. Let us listen to an address rather by the national chairman, Clinical Pharmacists Association of Nigeria, Dr. Maureen Wanfo. Ma, please, can we hear you now?
The moderator. Should I go ahead?
Yes, please, ma.
Okay. It's really unfortunate that tonight we are discussing about digital health, and behold, network couldn't allow the speaker to present it to us. But I'm glad we have his slide, and we've been listening for a while before he started having issues. Okay, I still want to thank all that join us, our elders in the profession, Dr. Fumilayo Oluwatoyi. Oh, she's always there with us. We say thank you for always being here with us. Our dear Professor Valodeli, you heard what he says. Thank you so much. I just want to say that from the slide, I don't think I say anything concerning drawbacks, because anything that is good must have one challenges or the other. Okay, and we are talking about using chat GPT. He told us that we can use it to do so many things, and I'm glad most of our lecturers are here. Okay, can you help us to really showcase the drawbacks of use of AI, especially ChatGPT? Though I know that we can use AI to improve our patients' adherence, follow up our patients, know how they are faring about their drug therapy, and so on and so forth. Because I know we still have some drawbacks. I am with anyone who can help us to really showcase some drawbacks, so that we know how to, get rid of such when we use AI in our clinical practice. Thank you.
Okay, so if you want to speak, kindly use the arbitrary hand, and then we'll give you the permission to speak. However, I know there are, whilst we wait for hands to, please raise your hand. Once I see a hand, I'll pause and allow the person speak. So I know we have challenges with accuracy. Most times, even when you are using AI or Chat GPT, they will give you an end note and tell you that um, some of the things here may not be too accurate. That hence you should look at it more. That is one. Secondly, is peculiarity of our client. um, most of the times, or some of the times, the things they are defining may fit in more for those abroad than those of us in Nigeria. So I think also peculiarity of our country is a factor that needs to be considered in AI. Another thing also that needs to be considered is there are moments of individualized treatment, better referred to as personalized medicine, in that you are treating a patient and regarding a patient as a patient. AI may not do that for you. Chat GPT may not do that for you. There are things a patient will tell you that is not what was reported to AI, or is not even what the pharmacist can see. There are skills a pharmacist should perform, percussion skills, or auscultation skills, and the rest of that. So AI cannot do that. AI cannot feel the vital organs of a patient. AI cannot touch. AI cannot use some of all these things. So these are the little drawbacks to, according to my little understanding. I don't know if any other person has something to add. Let the person can unmute his or herself and talk. Okay, I can see a hand up. Whose hand is that? Okay, Professor Valodili, please, are you raising your hand again, or is it the first hand raised?
It's a new hand.
Oh, okay, ma. Okay, please, ma, you have the floor, ma.
Okay, this is
Professor Odili is a man.
And is a man.
Oh,
You better start using AI. King, what's his name? King David, right?
Is giving me wrong information, sir.
You better use AI now. All right, thank you so much. Thank you. All right, yeah, like the CPAN chairperson said, every good thing has a drawback, right? Except for God. Okay. So there are actually drawbacks. And for us who are just trying to catch up with what's happening, in the digital world, we have a lot of things to do. First and foremost, we don't have the policies in place and laws in place, for the use of this. Like, for instance, in my school, it's just now beginning to have our own policies for the use of AI. In other places, they already have all these things in place. So when you talk about ethical practices, it's based on the policies that they have. We don't have that now. So people can do a lot of things with AI and get away with it. But we don't have those policies in place. We don't have laws governing how we use AI. That's the first thing which you actually be thinking of. Okay. Then there's this issue of confidentiality, right? So if you go and impute certain things about a particular patient and you don't remove the name and everything, it's in the AI database, and it can actually divulge some of those things. It may not actually do it deliberately, but it's a machine and it can come out. That's one drawback. Another drawback is that AI actually hallucinates. It's like, when we were leaving school, then they said the pharmacist should not say does not know, particularly when it has to do with drugs. Say, I will get information for you. I will go and find out. Don't ever say you don't know when it comes to drugs, because you are the expert on drugs. The AI is like that. It hardly tells you, I don't have this information. And sometimes AI hallucinates. It makes up, it fabricates. It makes up information that are actually false. And it will give you references for them. But go and check, you can't find. So you have to be careful, right? So it's not everything that it says that is true, but it's improving by the day. And AI is only as good as the resources it has, the databases that it can cover, and what has already been done in that area. So we must be careful. That's why you talked about the fact that you have that disclaimer. They tell you, yes, this is just AI, is a machine. You have to still do your due diligence. So you can actually make errors. All right. So these are some of the drawbacks. And then there can be downtime. Sometimes you input some prompts and then it just stops. So if you're used to that, you don't know have other means of getting information, and then it stops and it's a critical time for a patient, what do you do? All right, these are drawbacks. Then let's talk about, for instance, you're talking about telepharmacy. Telepharmacy is totally built on technology, everything. So what it just means is that you have a pharmacist in a remote place, and then you have the pharmacy set up in another place, and the pharmacist can be in different places from one place in his house, using ICT to communicate. So like we just had now with our presenter, he couldn't log in, or he couldn't connect because of probably network or stuff like that. That is the disadvantage. But if we had a live seminar, he'll be there already, and can be sure that once he's there, he will be able to deliver. So these are some of the drawbacks we have, with AI. There are other subtle ones that can just happen, particularly sometimes with a patient real time, and some drugs that the AI will be talking about, because that's what is available to it, right? But we don't even have those drugs here in Nigeria, like somebody was saying, but what is now being used, because that's the databases that it's available to the AI, that's what is going to be given to you. Whereas what you need for your own particular patient now, the drugs probably are already obsolete for the AI, so it may not give you that. And another drawback is that you must know how to prompt it appropriately. Is what you give that you get. They say garbage in, garbage out. If you don't know, you have to. So people are actually learning now. It's actually a field of study how to generate prompts, the best kind of prompts that you should use to get the best out of the AI that you're using. So if you're not skilled at that, it's also a drawback. So the quality of information you get from the AI depends on the kind of questions that you ask. It will give it to you at your level, and that may not be the best, at that particular point in time. So these are some of the drawbacks that we have. Of course, power is a major drawback. Power is a major drawback. So for most of us, in some places, you cannot trust power. Once power goes down and you cannot charge your phone, you don't have access, there is a problem. So we should keep this at the back of our mind, not to think that AI is the be all and it all. There are always things that we should be able to understand and then look at how to bypass these barriers. Thank you.
Okay, thank you so much, ma. Thank you so much, sir. Dr. Maureen, ma.
Okay.
I think Prof is done speaking.
Yes. Thank you so much. I really understand all you said. You did very well. Thank you, Prof. Please, I would love us to listen to our dear mom here online, Professor Olajoke Aina. Ma, please, you're a professor, you're in the academia. Ma, please, can you throw more light from what our dear Professor Val said? Thank you. Professor Aina, are you here? Okay, while we wait for her, Dr. Issa raised his hand earlier. Dr. Issa, you can have the floor now. Thank you.
It's all right. Professor Ojili has said what I wanted to say, so it's okay. Moderator, please, you can take over.
All right, thank you so much. A national chairman, I don't know if you are set for the closing remarks, but prior then, I would like to find out if anybody has a question from the foregoing conversation, what the presenter presented before he left, what our dear Professor Dele told us. He really elucidated the discourse, and from what other people have said. So I don't know if anybody has a question to ask. You can signify by a raise of hand so that we can allow you ask your question. We are privileged to have elders around us who would answer. So I don't know if anybody has a question. Kindly raise your hand so that, okay, I'm seeing a hand being raised. King Charles, pharmacist King Charles, can we please hear you ask your question?
Okay, thank you, the moderator and the seniors in the house. And also I want to thank the national chairman on this call. Please, I want to ask, I think someone had mentioned about some of the instances where the technology, be it AI or any other platform, can make up an answer or can coin something based on the question being asked. He didn't want to come out negative, a kind of is not available. Okay, now you know that most of the time we are utilizing these facilities is always on the go. You need that information as immediate as you can. So on that issue now, how will you even start finding out? Because at that point, it is supposedly that the tool you are using is the all-knowing. Let me put it like that. Because from which other platform will you now want to go to verify the information, especially when you have to do with some critical decision that you have to take? I don't know if I'm being understood. If I'm not, I can throw more light. That's my question.
Prof, please go ahead.
Okay, I should throw more light.
All right.
No, Professor Dele is answering you now.
Thank you for your question. Beautiful question. So that is where the being human comes into play. Now, if you recall, I don't know if you attended when we discussed drug information services, right? It's basically the same thing. If you see the AI as a tool, you will now need to follow the steps, okay, to evaluating information. So what you need to do is this: you need to compare. Okay, first and foremost, in your practice, begin to look at the different AI platforms available, and they usually rate them and rank them. So look at the ones that have shown reliability over time, and then have about 2 or 3 or 4 of them handy. So when you want to get any critical information like that, you don't just use one. All right, you can use different ones, particularly from different places, different companies. All right, the ones that have been tested. And then if they are giving you similar information, it's likely to be correct. But don't just stop there. You need to also do your own due diligence. So you go and then take one of the information, for instance, that you have, and then go to the more reliable websites, for instance, PubMed and all that, and run the information there as well and see what is given to you. Ordinarily, the AI is supposed to assess all these different databases to give you the most recent, up-to-date information. But like we said, sometimes there might be a glitch and it gives you something that is not correct. So if you're using 3, for instance, and the 3 of them are giving you something that is consistent, it's likely that that is the state of the art information available at that time. But you don't just stop there. You also, by yourself, you go and check secondary information databases, and then even go to primary information databases. So you go to PubMed, you go to any of those repositories, all right, that are very reliable, and then you check some of the information that you're getting and see whether they tally. If they do, then you're good to go. You know, that's how to go about it. If you do that, you run a very small risk of making grave mistakes like that. I don't know if that answers your question. Do you understand what I just said?
Yes,
Thank you.
Prof, thank you so much. Thank you so much. But just a little one again as a follow-up. Like there was once I was doing something with AI, or rather on AI platform, though it wasn't a medication-related topic. So the prompt I used and the what I got, I know I coined the needed prompt I needed to use to extract what I need. But the response I got, I was just like, let me just kind of psych this AI. I was not trying to argue with it, like trying to raise a counterpoint based on what I used to. And what I happened to find out that at the end of the day, AI was now agreeing to what I was saying. So that becomes, to me, it was very surprising.
Worrisome, right? Yes. That's why it's a machine. It's actually a program, all right, and it learns. You know, with everything, every prompt you make, and with every new information it gets, it updates. So it's actually in a learning process. As you tell you, I'm still learning this. I'm still learning this. I'm still learning this. You know, there's been a time I actually asked it to translate something, okay, for me into Igbo or something like that, and then immediately it gave me a translation in Igbo. But after a while, it removed it and said, "Oh, I'm still learning the language. I'm still not done. I'm still learning the language." Do you get that? So it's actually a program, and it depends on how it's being programmed. So if you speak empathically to it and tell it that this is what it is, it assumes that you have information, and then it wants to learn. It includes this in the database, and then you'll be surprised somebody else asks that question. He will use your own answer. That's why you need to be careful with it. You get that? It has not. It's probably after it has been here for a very long time, and then it has access and it now knows the particular subject very well, that it can tell you no. And even if you argue with it, it will not emphatically argue with you, because it's not programmed. It's programmed to be very polite and courteous. You get that? It will tell you may be right, but this is what I know for now. You get that? So that's why we should be careful. It's still a machine, all right? But as the time goes on and it has more information and it's being programmed differently, it can actually begin to stand to argue with you. But if you are a lawyer, for instance, if it was a lawsuit where it knows that here you need to argue a case based on some standards, it will take a position, all right, and argue with you. You can tell it to reverse position, and then it will take the opposite position and actually argue with you, based against what he just proposed before. So know that it's a machine, you get that, and know how to use it within limits of what is reasonable, so that it gives you what you need for your own work.
Thank you, Prof. Thank you, sir.
Okay, thank you so much, Prof. Sir. We really do appreciate. Any more questions? Any more questions? All right. In absence of the questions, we would have the national chairman
Sorry.
back in.
So let me make an announcement. Sorry.
Okay.
Okay. So for those that are sending messages on the platform asking for the slides to be sent to their mails, we don't send slides of presentation to email of participants. Rather, we drop them on the CPAN platforms because they are for CPAN members. So please, you can go to the CPAN platform to get the slides. If you're not registered with CPAN, you can as well apply and register to be a member of CPAN, and you have those benefits of what members of CPAN have. Thank you very much.
All right, thank you so much, sir. Somebody is already asking to be added to the group. To be added to the group, you need to be a registered member of CPAN, and the registration fee is actually quite affordable. We are also open to members both in Nigeria and in diaspora. So, Dr. Morinwa, for the national chairman, can you please take the floor for the closing remarks so that we can wrap up today? Thank you, ma'am.
Good evening, everyone. Once again, I want to appreciate our dear presenter, Dr. Ike Bello. So he had issues with his network. So you just have to let us know the drawback one can find when we are using AI. It's by the grace of God, as this country will continue to get rid of the challenges. But I still maintain that AI is very important for us, clinical pharmacy. It's very, very important that we start to know how to use them. And as Professor Dili says, sometimes you may need to cross-check with other tools to be sure of the information that you're getting. And also looking at your patient clinical situations also, if you have the information which is somehow variant from what's happened to your patient, and you know that there may be issue with that particular tool, without trying to check another one. So AI has come to stay, and we clinical pharmacists must have to meet up with the trend in the whole world now. So I encourage all of us to step up our practice by the use of AI. Check the ones that we can have access and start to make use of them to improve our patients' outcomes, both humanistic and economic as case may be. So I want to thank all of us. As our dear National Secretary said, the PowerPoints will be shared on our platform, 24 Pharmacy platform. If you want to join us, feel free to contact us. We'll let you know how to go about it. It's like God just sent our dear Professor Val all the way to be here. It's like he's the second presenter. So we appreciate it so much. God sent. Okay, next week is another day. Always join us and we continue to educate ourselves in order just to improve our patient health outcomes. Thank you so much. And I want also to appreciate our dear moderator for having us. I is trying to present, even when he's not the presenter. King David, thank you so much for bridging the gap. Thank you also, our dear Education Committee Chairman, Famifi Moma. Thank you so much for the good work you are doing. God bless all of us.
Okay, thank you so much, ma. Just before we pray, let me recognize Dr. Obiajero Wayemero and Dr. Chinelo Chukwu. Ideally, nobody is supposed to speak after the chairman has spoken, but we should recognize them. And I know the chairman has granted that permission. So we'll be having a closing prayer now. A Christian took the opening prayer for us. I'd like to request that.
Sorry, Farm King David. Good evening. Good evening, everyone. Hello?
Yeah, we can hear you, ma.
Okay, sorry, let me just I just saw where somebody is making a request on how one can join CPAN. So I would like to respond to that before the closing prayer is said. So for all those, my name is Dr. Obiajiro. I'm the National Finance Secretary 1 for CPAN. So for all those who have the intention of joining CPAN, You can I'll drop my contact on the platform right now on the chat group. You can reach out to me privately. I send you the details for you to make your payments so that you can now be added to the national platform and issued a registration number. So I'll be dropping my number right now for those that want to reach out to me for registration. From King David, you can go ahead.
Okay, thank you so much, National Finance Officer. Thank you, ma'am. All right, so please, we'll request a Muslim to help us with the closing prayer. Any Muslim can please help us. Is anyone speaking?
على النبي الكريم سبحانك اللهم وبحمده أشهد أن لا إله إلا الله أستغفرك ونتوب إليك سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين. Thank you all.
Thank you so much, Pharmacist Wiskat Ibowo Mojisala. Thank you, ma'am.
Yeah.
Good night, everyone. Enjoy your night.
Good night.